Hi, I'm Dr. Susan Perkins, and I'm here to give the 2022 Professional Practice Committee Report for the North Carolina Association for Marriage and Family Therapy. Mental health has been getting national attention these days, with President Biden focusing on mental health in his State of the Union address, when he called for bipartisan support to increase resources and strategies for addressing the mental health crisis across the United States. Here in North Carolina, NCAMFT has been focusing on following legislation and also advocating for strengthening MFT throughout the state. I'm going to talk in this report about three different things. The first one is what NCAMFT has been doing. The second thing is a couple legislative aspects that you need to be aware of right now that are impacting you directly. A few things that are coming down the pike, and some larger social awareness to be tuned into, even though it's happening in other states. So as we're paying attention to what North Carolina Association for Marriage and Family Therapists is doing right now, we're staying pretty active, staying tuned in, and also supporting in small ways. Here's a little bit of how we're doing that. We're following AAMFT's team, which is their advocacy arm, staying aware of what's happening, seeing how we can get plugged in. We also, NCAMFT continues to have a lobbyist on our payroll, and John Carr monitors every legislation that comes through North Carolina legislator to see if there's things that could have an impact on marriage and family therapists. He alerts us and also helps us think through how those things could be impacting MFTs, so that we can make decisions about where to put our time and energy to support MFTs now and also in the future. NCAMFT is also involved with an association called the Professional Association Council. This is a group of leaders from helping professions from the North Carolina chapters of social work, counselors, addictions counselors, psychologists. I think there's a couple others. We meet monthly and help all of us stay aware of what's going on across the state. Through some of that, we've had the opportunity to make sure that marriage and family therapists are involved with various legislative requests. The first one is, are you familiar with loan repayment programs where mental health providers can be eligible for their student loans to be paid off early if they meet certain criteria? Well, we have, along with the other associations, have asked North Carolina's Secretary for the Department of Health and Human Services, Cody Kensley, to apply for that grant for North Carolina, which would expand those resources to MFTs as well as other helping professionals. We've also written a letter of support for that grant in conjunction with the other helping associations. We've also signed a letter to the Joint Legislative Oversight Committee on access to healthcare and Medicaid expansion, asking them to expand Medicare access, asking them to continue covering teletherapy, and also always emphasizing mental health parity so that mental health would be reimbursed at equitable rates on par with physical health reimbursement services. So that's what's happening with NCAMFT on an ongoing basis. Now I'm going to switch and talk about some specific legislation that is affecting you right now. First thing, hopefully you already know about this, is called the No Surprises Act. The big joke about the No Surprises Act is that it surprised most health professionals and certainly mental health professionals. We found out about it in December 2021. It is an act that's designed to avoid patients and clients from getting big surprise bills for services that they received that can create significant financial difficulties for them. So because of that, we, as of January 1st this year, we're expected to give clients good faith estimates, put a notice on our office and in our website, and let clients know what they can expect to pay and also how they can dispute bills if the bill is different than what they were expecting. Now that happened really quick and no one really knew what we needed to do. So NCAMFT hired our lobbyist and asked John Carr. He put together a presentation for us, and that presentation is available. It was recorded, and it's available for NCAMFT members. You can access that through one of the links that Kathy will be sending out to you either after today or after the conference. So you'll be able to get that. You can also go on to AAMFT's website and get more resources and some templates there to help guide that. The second thing that you need to know about is the North Carolina Health Information Exchange. This is something that has been in the works for a couple of years. What it is this was designed to support communication among the various professionals who are working with a client so that information could be exchanged easily, electronically, and providers could see what other providers were doing. What that means is that any providers who are taking North Carolina state funds have to connect to North Carolina's their health information exchange so that the information about clients would be uploaded automatically. It's limited information, but it is some basic info about what's happening with your clients. You'll also get a link of where to get more information on that if you're not tuned into that. The deadline for that has been extended multiple times. Right now, it's January 1st, 2023, and you do have to sign an agreement and connect. The other thing that has been happening recently is that Blue Cross Blue Shield just recently extended the coverage for telehealth through September 30th, 2022. It was really short notice that they did increase that extension. And so we're really hoping and planning to pay attention to that date, try to put some pressure on them to, along with the other associations in the PAC, to help them give more notice to providers in the future. So that's what's happening now that affects you that you need to be aware of. Let me give you a heads up on a couple of things that are happening nationally. Nationally, the first thing is the Mental Health Improvement Act of 2021. Now, what this is a law revision at the federal level that would allow marriage and family therapists and licensed mental health counselors to be in-network providers for Medicare services. Since the Medicare Act was introduced, unfortunately, licensed mental health counselors and marriage and family therapists were left off of that. We're not able to be in-network providers. That means that Medicare, which is the largest health organization in the United States, I think about 20%, which is billions of dollars of healthcare spending, for the people who have those plans, they're not able to access counselors and marriage and family therapists, which is 40% of the mental health workforce. It's a huge discrepancy and creates a lot of problems, lack of opportunities for us, as well as problems when it comes to accessibility for people who are on Medicare. So lobbyists for MFTs and counselors have been working for decades trying to get this to happen, and we're hoping this is going to be the year. So what you can do is go onto AAMFT's website, look for that information, and I can send you a link for that as well. Call your members of Congress and ask them to co-sponsor that bill. It's closer than it ever has been to being looking like it's going to pass, but it always helps to have as much momentum as we possibly can. The second thing that you need to be aware of nationally is that Medicaid, which is based on financial need, Medicaid eligibility was extended through the pandemic. But as the pandemic ends, that extension is expiring. This could potentially mean that there's a bunch of people whose Medicaid funding ends and have not found another medical insurance option yet. So a bunch of people could potentially be uninsured. They're trying to get the word out about that so that people are getting a heads up and working on that in advance. But there's not a lot of buzz around that. So be tuned into that. And some various efforts that are happening to try to prevent the problems that can come along with that. So that's what you need to know that's coming down the pike at the national level. From a social perspective, there's some things to just be aware of that are happening in other states. In Texas, the governor and attorney general recently made a statement saying that they interpret the child abuse law to include any gender-affirming treatment for transgender individuals who are minors. That automatically made mental health providers mandated reporters for gender-affirming treatment, saying that we have to report that. Well, mental health providers in Texas have to report that to CPS, and that those cases will be invested as child abuse cases. At this time, there have been some parents who have been taken to court for this reason, saying that they're abusing their children by providing gender affirming treatment. And so far, those parents are winning the cases, but there's more in court, and I'm sure this is going to be an ongoing legal battle. In addition to that, Georgia has passed legislation at one level. This has been passed but not signed into law, and I think it was passed in the Senate but not the House. And this legislation bans the participation of transgendered athletes in the sports teams that are aligned with their gender identity. Florida, the House of Representatives, passed 2 bills that impact educators and mental health providers who are working in schools. The first is the Don't Say Gay or Trans bill, and that bill prevents people in schools from saying the words gay or transgender. I think it's elementary levels, but I'm not positive. The second is the Stop Woke Act, and this prohibits educators and mental health providers who are working in schools from talking about gender, sexuality, race, or discrimination. It's passed in the House, but not the Senate, so it's in the works. Alabama House of Representatives, same thing, passed in the House, but hasn't gone through the whole process yet. They passed a bill to ban transgendered students in schools, K through 12, from using the bathrooms and the locker rooms that match their gender identity. So be aware that those trends are happening. So here is what you can do. No presentation around anything related to legislature would be complete if there weren't some sort of call to action. So here it is. So a few things you can do. The first thing you can do is just go onto NCAMFT's website, go to their section that says Advance the Profession, click on that and sign up to get alerts from NCAMFT's team. That keeps you up to date on what's happening. You'll get those links for how to advocate on an ongoing basis. The second thing you can do is when you renew your NCAMFT membership, be sure that you're clicking that box to continue joining NCAMFT as a member. You can also join the special interest networks, and that keeps you up to date on what's happening in those specific content areas. Those topics, they do a really good job of sending out emails and updates. You can also follow the NCAMFT members Facebook group if you're not already. I'm going to be posting more and more about what's happening as we learn more about it. So stay tuned there. Please do already make the decision within yourself that you're going to follow those things when there's an opportunity to speak up, that you'll take literally is less than 5 minutes to contact your legislators. It makes so much difference for them to hear from you. They don't hear very directly from constituents very frequently, particularly not from people who know what they're talking about a lot of times, unfortunately. So when you speak up, it really does make a difference. And anyone else that you can get on board and encourage them to speak up as well, please do that as much as possible. Next year in February, there's going to be the 45th annual legislative breakfast in North Carolina, where mental health professionals and legislators just get together and talk about what's happening in mental health and what's needed, what the trends are. It would be amazing if a lot of MFTs show up for that and really have a strong presence. That speaks very loudly to the legislators. They're there ready to listen to this specific information. Thank you so much for all the work that you are doing and for supporting NCAMFT. And we look forward to advocating for you throughout the next year.